For today's inaugural ceremony, with me here, Chief Guest, today's function Chief Guest, His Excellency Sri Rajendra Allekar, Honorable Governor of Himachal Pradesh, and he's our close family friend for more than 25 years. He has been my mentor. I mean, we are both closely associated. Guest of honor, Honorable Justice Ujjal Bhuyen, Chief Justice Telangana High Court, President of ARIS, Professor Subhash Khanna, President IAGS, Dr. LP Thangavelu. I could speak to him Tamil today, few letters. So I was really happy after many years, that I met some Tamil. And anyway, many people come to me. Many Tamilians from Goa, they come to me only because I am speaking Tamil. Not that I am a good ophthalmologist. Dr. Honorary Secretary ARS, Dr. Vivek Bindal, Dr. Satish Midha, Honorary Secretary IAGS, my dear all doctor colleagues, press. In fact, indeed, it's my great pleasure to be here with you all today on this beautiful evening. In fact, last night CM called me and he said he has to leave, go out of Goa, and he says, you are the right person since you are a doctor, please do attend. And today morning I got a call from Professor Subhash Khanna, and I was coming out of the OT, I was about to go to OPD, and I said, I'm just finished the OT. But since it's a conference, CME, I could not say no. It really gives me nostalgic feeling to be around here. I'm definitely not going to speak on your subject, because if I speak something, and being a doctor, if I make mistake, you all will not pardon me. It is definitely not ophthalmology. I run a hospital also. My hospital is 100-bedded, super specialty hospital. My wife is anesthetist. There are around 7 doctors in my family. So basically, I am like, with doctor, I know, I started my career way back I joined MBBS in 1990, 96 I passed out, MBBS, MS 2000 to 2002, I did my fellowship in Arvind Eye Hospital in anterior segment and phacosurgery. When I started my career as an ophthalmologist, today only I was telling one of my junior colleagues, I have got around 9 ophthalmologists working for me. In fact, mine is the only super specialty eye hospital in Goa. In Goa, that way in medical, we are doing quite a great job, but we still require a lot of advances and all. So I started with ICC. Many of you all must be knowing, was senior to me. We used to not put lens. I did some few ICCs of 20 cases. Then we converted to ECC. So till MS, it was only ECC. After MS, when I joined fellowship, that is the time where we small incision cataract surgery with SICS, and then converted to phaco. Now why I am telling you all this, especially for youngsters. So when I was youngsters, I always had a fear. Okay, I have to learn phaco, but phaco machine is very costly. How will I recover that money? And that learning, that fear was there. There are so many, small incision cataract surgery, it's a manual. Everything is with hand. I was feeling that time, not this time. Way back 18, 20 years back, that full control is in my hand. Full surgery is mine. I can nicely deliver a nucleus, nicely put a lens, and patient can get a good vision. But there are some disadvantages. There are astigmatism where there, patient has to use glasses. And then that time I used to wonder why I have to learn phaco if I can give good vision to patient. Patient is happy, I am happy, no investment in machine. Everybody is happy. Is there a need of to learn phaco? But now I realize, yes, it is must. Then slowly we, took over to phaco, bought phaco machines. Like initially, when you start a practice, everybody, it's all depend on your pocket and all like that. Unless you are working. Many of you all must be working for a corporate hospital. But if you have individual practice, all depend on practice. But now I realize, had it been if I had not learned phaco that time, I wouldn't have been anywhere. I would have been almost like, wiped out. There are many surgeons who are just practicing, but they are not doing surgeries. Somebody comes to their place as a ghost surgeon. They come, they operate and go. Now I realize, let's go financially. The money which I make is literally multiplied. Because if you are expert in any subject of yours, you can literally mint. Now I do phaco in just 10 minutes. 10 to 12 minutes is more than enough for me to do a phaco. So see how my money. But to do small incision doesn't take much time, 50. But people's demand have increased. People are ready to pay if you give them the right, means what you say, and if you give them the result, people are happy. And secondly, a time was there, I started practice 20 years back, 2002 I started practice, exactly 20 years back, 8th November 2002. A time was there, people were not ready to spend on surgeries. I don't know in other part of country, but definitely I have got friends in all over India, outside India. People are ready to pay. And forget that, you see the medical tourism, especially in Goa and all. Every day you will see our OPDs with some white people are coming. They come why? Because they always feel Indian doctors, they have faith in them. I'm not joking. Today I did around 20 cases, out of that 4 to 5 were foreigner. And they come with all those, multifocal, trifocal. I'm using all this word with you all, ART, because you all well versed with it. Somebody must have undergone, or your parents must have undergone. So all of them, and then they still tell what we charge here is very minimal rate. So basically what, my request to younger generation surgeon, please join this society of robotic and all. Please learn it. We are going to go forward only, we are not going to come back. It's a need of our. Cost is the issue. Just now the Honorable Justice has said, Chief Justice, insurance companies also down the line, they will come and they will agree for these packages. Yes, initially the cost will be high. Now to reduce this cost, corporate are sitting there. Management administrator is sitting there. He is going to do calculation. Probably he will buy one machine and they may ask 10 surgeons can come and operate there if one of you all cannot operate. Like how we do in LASIK. LASIK for smile and all, it costs around 4 to 5 CR. If one surgeon cannot afford, we buy at one place. 4-5 surgeon goes there, get patients, operate and divide. That can be done. But be with time. That is one thing. The second thing, you see the quality care you are giving to patients. Now our patients in ophthalmology, if they operate today, I tell them after 4 days, immediately after 10 minutes you go home. No bandage, no injections. And you want to go and join your office, sit in your office, go and do practice, sit in a court, or you want to go in your constituency, go after 2-3 days. That was not there. The chances of the infection rate which was there is definitely, it has reduced, which you all very well know. That's why I'm not going to talk to you this. I'm just correlating. I have gone through your brochures. The topics are fantastic. Everything. I think everything is there. Only thing, one topic I request any conference, one topic of a business management of a hospital should be introduced. So that doctors has to be entrepreneur. Now why I'm telling you, otherwise somebody will sit there at that corporate hospital, full life you all will slog. He will start a hospital with some 20 crores or 40 crores. You all will slog full life. You all will retire. What he has invested 40 crores in one brand. After 10 years, 20 years, he will sell it for 400 crores. And what you all will get? 5 to 10 lakh salary a month. This is what is happening. So that business management attitude has to come through you. Why a doctor cannot be a businessman? What is lacking him? Is businessman something different? If I don't know to handle my practice, I don't know to manage my practice, then who can know better? We feel we are the cream of society. So basically, see my question, please understand me, it's not to make money. It is not there. Absolutely, I am telling you, I am not there. If I was there to make money, I wouldn't have joined politics. My practice is total. It's like mass practice mine. Means the poorest person who cannot afford cataract can come to Goa. I am the only doctor in Goa to do full Goa Rotary Lions free surgery. Per year 500. Any Rotary club can come, Lion club, अरे मुझे 10 करना है, 50 करना है, 100 करना है. Those I operated one club 400 cases per year free surgery. I will go to nearest corner of, I have got many clinics in Maharashtra, Sindhudurga. Still go. Tomorrow, in fact, I am going this Sunday. I'll go there. I'll still do the small incision cataract surgery because they are real poor people. I've been doing for years. I go monthly once there. आराम से ऑपरेट करता हूँ.